Hey everyone, welcome back to the Mass Retirees Weekly Update. Today's Friday, November 3rd. I'm Sean Duhamel. Thank you so much for tuning in and joining with us this week. The topic this week is based on a frequent question that we get from virtually all members. And that question rests with, how do I enroll in Medicare and what happens when I turn 65? At times, the question can also vary to, am I eligible for Medicare or do I have to enroll in Medicare? And this can be quite complicated, confusing, anxiety-provoking. So it's a topic that we like to revisit from time to time, and I want to thank our insurance coordinator, Cheryl Stillman, for putting the bug in my ear to say, hey, Sean, I'm getting a lot of questions on this again. This is something we should update our membership on. And keep in mind that we're constantly recruiting new members. We have people joining us, and people lose track, of course, of the ins and outs of these different issues. And even us working on this issue and putting together this week's email message and coming up with exactly what I wanted to talk about in this video, it's complicated and it's confusing. So I hope at the end of this you have a little bit better understanding of what the requirements are for you as a public retiree, that if you are Medicare eligible, that you have to join the program. And if you're not Medicare eligible, what that also means to you. And I really hope that above and beyond everything else, that this does not leave you more confused or feeling a higher sense of anxiety around all of this stuff than you did before. Of course, if you have questions or concerns about this topic or anything else, give us a call, reach out, send us an email. You have my cell phone number as well as our entire senior staff's personal contact information on the back of your Mass Retirees membership card. That is one of the key services that we provide to our members, that we're here for you. We're here to answer your questions. We're here to help resolve any retirement-related problems that you might have. So if you have a question about Medicare enrollment, the best person for you to call is Cheryl Stillman. She's our insurance coordinator. If you can't get through to Cheryl, or if you'd like to contact myself or Nancy or Bill, any one of the four of us can help walk you through this process. So let me start with the basics. As public retirees in Massachusetts, if you are Medicare eligible, then you are required to join Medicare, both A and B, in order to remain on either the GIC health insurance plans or on the health insurance plan that may be being provided by the city or town that you retired from. All public retirees in Massachusetts under state law, if you're Medicare eligible, you have to enroll in Medicare once you become eligible for it. If you're not eligible for Medicare, you're going to be required to provide proof of your non-eligibility by getting a letter from Medicare or from Social Security, just simply stating that you're not eligible. You would provide that to the GIC at the state level or your local city or town healthcare plan, and that satisfies the requirement. You would then remain on the non-Medicare health insurance plan forever. Just like you're on right now, nothing would change for you. However, if you are eligible for Medicare, you would then enroll in the Medicare plan, and the GIC or your local health insurance plan would become your supplemental coverage. And what I mean by that is that Medicare becomes the primary health insurer for Medicare enrollees. And then the Medicare supplemental plan, which you may have heard it referred to as MedX, or at the state level under the Unicare plan, the Unicare Medicare Extension Plan. These are variations of what we call a Medicare supplement plan. The Medicare supplement plan pays for things like prescription drugs, tests, doctor's visits, things that Medicare either doesn't cover or does not cover in its entirety. Medicare Part A covers hospitals. Part B is primarily doctor's visits, tests, things like that. Medicare Part C is the Medicare Advantage plans. One quick word about Medicare Advantage, and there's an article in this month's newsletter all about Medicare Advantage plans. Unless it's a Medicare Advantage plan that is being provided to you either through the GIC or from your local community, do not enroll in it. And what I mean by that is the plans that you're seeing advertised on late night TV, that you're getting solicitations in the mail or maybe even phone calls at home trying to sell you something, ignore all of that. Do not enroll in it. However, again, if it's a Medicare Advantage plan through the GIC or through the City of Boston or one of the other local communities that are now offering Medicare Advantage, if it's something that's of interest to you, take a look at it. And if you think it's the right fit, go with it. But don't go to a private sector plan. It would be a huge mistake. So Part C is Medicare Advantage. And again, for most of you, you don't have to worry about Part C. Medicare Part D is the prescription drug benefits through Medicare. And if you are enrolled through the GIC as a Medicare enrollee, you would be familiar with CVS SilverScript. That is a Medicare Part D plan, and the GIC would automatically enroll you in Medicare D to be able to utilize the prescription drug benefits. So let's break this down in terms of, okay, I'm turning 65. What do I need to do? Well, the simplest scenario is if you are eligible for Medicare on your own, meaning that you earned at least 40 quarters under Medicare. Now, there are a couple of different, actually 3 different ways that you can qualify for Medicare. One is by, if you qualify for Social Security, you automatically qualify for Medicare because you need 40 quarters to qualify for either Social Security or Medicare. So you get your 40 quarters under Social Security, you automatically qualify for Medicare. However, you can also qualify for Medicare through Medicare itself. And what I mean by that is here in Massachusetts, any government workers, any public employees who were hired on or after April 1st of 1986 pay into Medicare. You don't pay into Social Security, but you pay into Medicare. So all of those individuals, assuming you pay in for at least 10 years, which is 40 quarters, you're going to be Medicare eligible just by simply paying into Medicare. So under either one of those scenarios, if you get your 40 quarters, you're eligible for Medicare. And all you need to do is contact Medicare and then contact either the GIC or wherever you get your health insurance coverage from right now and enroll in the Medicare supplement plan. I should also add, most importantly, Medicare eligibility for everybody does not begin until you're at least 65 years old. If you're 65 and you're retired, you are then eligible for Medicare. But let's say you're 65 and you're still working full-time. Well, you do not need to enroll in Medicare until you are no longer working full-time and have coverage under a non-Medicare plan. Once you are retired and you pick up retiree health insurance, then you need to enroll in Medicare if you're over the age of 65. And I hope that makes sense. So what we advise members to do is about 5 to 6 months prior to your 65th birthday or prior to the date that you're planning to enroll in Medicare, reach out to Medicare, start the process, also start the process with the GIC or your local community. We used to advise retirees to do it about 3 or 4 months out, but because of the employment issues and a lot of the problems going on at the federal level with not having enough staff and not having enough qualified staff, is taking a little bit longer. So we're advising reach out at least 5 or 6 months in advance. Medicare allows you to apply for coverage 1 full year before you're eligible. So you can even do that. But 5 or 6 months is usually going to give you enough time. The second scenario in which you might become eligible for Medicare is through your spouse, and that applies to a lot of our members. Let's say you are a retired teacher and all you did for your whole career was be an educator. You never worked in the private sector, so you never earned your own 40 quarters either under Social Security or if you were hired before 1986, you never paid into Medicare as a public employee. But let's say your spouse does qualify. They may have been a private sector employee, they may have been in the military and cobbled together enough quarters that they qualify. If your spouse qualifies for Social Security or Medicare, you then also qualify for Medicare upon reaching age 65. And the same requirements to apply would apply to you, and it's the exact same process I just described. Now, you can qualify through your spouse once they become Medicare eligible, or excuse me, Social Security eligible. Eligibility for Social Security begins at age 62. So let's say you're 65 and your spouse is age 62. You are eligible for sorry for being confusing. You're eligible for Medicare once your spouse is eligible for Social Security at age 62. So you would need to apply. Because you are not receiving a Social Security check, if you're not eligible for Social Security, you will then be paying Medicare directly. They will bill you on a quarterly basis for your share of the Medicare Part B premium. As long as you're eligible through your spouse and they're eligible for Social Security, there are no additional penalties. Where this gets really complicated, if it's not complicated enough already, is under situations where there is a significant age difference between spouses. And what I mean by that is that there is more than a 3-year age difference. So if you're 65 and your spouse is only 61, 4-year age difference, they are not yet eligible for Social Security, so you're not yet eligible for Part A under Medicare, the hospital insurance, for free. You could buy it on your own, and it's several $100s a month, or you could wait until they become eligible for Social Security, and then you can enroll in the program without having to pay those additional fees. Now, where this even gets more complicated is when it comes to the late enrollment penalties that Medicare will assess to you if you enroll in Medicare late. And what I mean by that is I think they give you a 3-month grace period. So once you turn 65, if you're eligible for Medicare, you have to enroll. If you wait, and let's say you're 66 when you enroll in Medicare, the federal government will assess a 10% penalty for each year you are late. So at 66, it's 10%. At 67, it's 20%. At 68, it's 30%, and so forth and so on. Those penalties never go away. Once the penalty is assessed to you for Part B, you will continue to pay that penalty for the rest of your life as long as you're enrolled in Medicare. And it can become pretty substantial over time. The other thing to consider is if you do not enroll in Part A once you're eligible, if you are late enrolling in Part A, there's also a Part A penalty, which is the duration of that is twice the length of your lateness. So if you sign up 1 year late, the penalty will last for 2 years. If you sign up 2 years late, the penalty will last for 4 years, and so on. So these penalties can become pretty substantial the longer you wait and the longer you are considered a late enrollee in Medicare. So what are you supposed to do? Well, unfortunately, there is no one-size-fits-all answer to this question. It really comes down to your personal circumstances and the age difference between you and your spouse. And what we advise members to do is simply sit down and do the math. Do a little bit of research, pull together what the Medicare Part A premium would be if you're paying out of pocket, what the Part B premium is, what those monthly costs look like, as opposed to what the monthly costs would look like down the road should you enroll late. Now, if it's just a year or two late, it might make financial sense to wait. However, if it's a longer period of time, that may change your calculations one way or the other. And I'm sorry that I cannot give you a definitive answer if you're someone who does have a large age gap between you and your spouse, and this is going to be a consideration. But again, there's no one-size-fits-all because everybody's circumstances are slightly different. Now, the most important thing to remember with all of this is that under no circumstances, unless you just refuse to enroll in Medicare, and the GIC or your local health insurance plan would be forced to disenroll you from the retiree plan, but you're not going to go without health insurance. If you enroll in Medicare, Medicare becomes your primary insurer, as I described, and the GIC or your local plan will provide the supplemental coverage. So in terms of the plan design and the benefits and how all of this interacts when you're going to the hospital or doctors or utilizing your health care, you really should see no difference. Now, there's always going to be slight variations or nuances with everything. So I cannot tell you that it's 100% absolutely the same as what you're getting right now, because again, everybody has their own different circumstances. However, what I will say is in almost every instance, once you are enrolled in Medicare A and B, your costs are going to be far less than what you're paying right now. The premiums you're paying should be less, and that's going to vary a little bit depending on where you're retired from and what the percentage is that you're paying for your health care. But what should be substantially less expensive for you is your out-of-pocket costs. The co-payments and the deductibles charged under Medicare tend to be substantially less than what are being charged on the non-Medicare plans for the active employees and what you would have been enrolled in prior to Medicare. The reason for this is quite simple. The federal government is subsidizing, heavily subsidizing the costs of Medicare. And the taxes you paid under the FICA tax when you were working or when your spouse was working, that money went to pay for the Part A coverage. So in some sense, you have prepaid for your health insurance while you were working under Medicare, and that makes a huge difference. Now, the email message that came out from me or comes out from me every Friday morning, it's sent to all Mass Retirees members. That email message today has a lot more detailed information in there on this topic. So if you are a member watching this video either on Facebook or YouTube, give us a like, but also go and look at your email today. That's going to give you more detailed information to help you make sense of all of this. But if you are a member and you have follow-up questions, you're a little bit confused, give us a shout. We're going to walk you through this. Now, the last point I want to make is that we know that we have thousands of retirees who are not eligible for Medicare and are stuck, so to speak, in the non-Medicare plans. This is something that continues to be a great concern to us for the reasons I just described in terms of the costs. At the local level, a growing number of cities and towns are implementing the Medicare buy-in program. We continue to urge the GIC and are working closely with the GIC to develop a path forward to implement a Medicare buy-in at the state level. As I have described in the past, and I think you've read in our newsletter, it's not simple for the GIC to be able to implement a Medicare buy-in. We're looking at least 10,000 non-Medicare eligible retirees. Each individual will need to have their personal Medicare costs calculated on an individual level. So this is a huge undertaking that just simply cannot happen overnight. However, it's important. We believe that there's a tremendous cost savings in doing this, not only for retirees, but also for the Commonwealth, that could amount to tens of millions of dollars a year. And it's something we think should be pursued, and we're going to continue to work with the officials at the GIC and the Commission, as well as the Healy administration, to move this forward, hopefully sooner rather than later. With that, I hope you're all doing well. We will be back to you again next week with a report on our trip to Washington, D.C. Hopefully we'll have some additional information on weapon GPO and the potential public hearing that may be taking place on those issues in the coming months, as well as a follow-up on the healthcare conference that Nancy McGovern and I attended this week. Thank you so much, and we'll be talking to you again soon. Be well.